Hello, I'm Dr. Mark Lorenzato for Paleo Legacy. In this video, which is presented particularly for individuals with cancer or at risk for cancer, we'll go over the Paleo Legacy model and the Integrative Medicine model of nutrition. It is important to understand some of the aspects of the theory. We'll look at the theory with a particular focus on angiogenesis, or the development of new blood vessels, which is critical for tumors and cancers to continue. So therefore the inhibitors are a strategy to slow the progression of cancers. Paleo Legacy fundamentals will be reviewed, as will looking at some of the specific molecules that are suggested by the Integrative Medicine model of nutrition. We'll discuss some issues of genetics, and then I'll make some recommendations. The theory behind the models. The Paleo Legacy model evolved because certain molecules, when given as supplements, benefit people. Vitamin D, EPA and DHA, the omega-3s, L-carnitine, menaquinone, the vitamin K2. All these molecules we've noted in studies, when given to individuals, the individuals do better. That suggests that they were most likely part of the ecology of our diet before civilization. They integrate as critical participants in biochemical pathways. The more one understands or appreciates biochemistry, we see that the pathways have evolved in biology over great periods of time, not tens of thousands of years, not even hundreds of thousands, frequently over millions, tens and millions, and even hundreds of millions of years. And we've had an abrupt, rapid change since civilization. By looking at the supplements that are beneficial, we can guess that many of them were part of our food ecology prior to civilization. And now, by returning these molecules to our diet, we are balancing our biochemical pathways more how they should be. This is true for vitamin D. We used to have more sunlight and make more vitamin D. For EPA and DHA, the critical omega-3s. For L-carnitine or acetyl-carnitine, carnosine, creatine, those polypeptide or amino acid molecules from meat. And vitamin K2, menaquinone. There are other molecules. It is understood through the biochemical pathways, and so therefore we can now compare how organisms' biochemical pathways have changed, because we can look at the structures of the proteins in different organisms through understanding their DNA and their RNA. This technology has just allowed a better understanding. Integrative medicine, used in Western medicine, saying that certain foods have molecules that are particularly beneficial, and that it is to the benefit of a patient not just to take drugs, but also to pay great attention to what they eat, and not just balance fats and proteins and carbohydrates, but also get specific foods, has got great value. And it is by looking at each food, and each food that contributes as a supplement will to our diet, and seeing how it helps us, that we can determine whether we should incorporate certain foods in our diet. A systematic approach to looking at the natural products in chemistry is another way of saying this. We look at each plant and see what specific molecules it produces that may benefit us. Catalog those, do studies of those, and decide whether we should be integrating those in our diet. That is the integrative medicine approach to nutrition. As cancers progress, they initially move towards a blood vessel for nourishment. At a certain size, they get bigger than they can get substantial nourishment from that blood vessel, and they have to make their own vessels. This is the stage of angiogenesis. Once a tumor is mature, usually it has 1.5% of its weight in blood vessels that is created. Mature tumors may not respond as well to angiogenesis inhibitors, or the things that stop the blood vessels growing, but it will keep them from metastasizing and setting up shop elsewhere. And it may contribute, as there's always a turnover of our body, probably including cancer cells. Many foods naturally have inhibitors of angiogenesis, and by looking at these foods, we can create a diet that benefits individuals. Recipes can be engineered to harmonize and balance things out. And supplements can be used because they can leverage our understanding, and you can get more of these inhibitors than you would get in your normal diet. When we look at different diet plans, we think Mediterranean diet. Well, that is the best copied diet. We look at people with civilization who are doing the best, and we say, well, the Mediterranean diet. Why? Well, it's as low in starch, it is low in sodium, it's low in refined oils. These are all parts of the paleo diet. Plus, we can see specific benefits of certain foods, yogurt, for instance. It is an evolved understanding we've gotten. There are other types of diets, those of restriction diets, where we say don't eat gluten or casein, the protein in milk, or soy because of the proteins for different reasons, or other elements in soy. And in integrative medicine, as I said, we pull together our understanding of very interesting plants and a long history of toxicology, looking at what's in plants and what are good and what are bad. The Paleo Legacy model, I feel, is the foundation to determine what we should be eating, what foods benefit us. So I generally start there and then recognize that each one individual is different genetically by their SNP or SNP, their single nucleotide polymorphism pattern. Their SNP pattern meaning their unique DNA pattern, basically. And sometimes if you have DNA studies, we can utilize those to better understand how you will deal with certain foods and supplements. Fundamentals of the Paleo Legacy are that the consumption of game meat was part of human evolution and played a bigger part before civilization. And with that, we got the EPA and DHA, the omega-3s. Now we have to look to the ocean to get, but those are in range-fed animals. They're also in particularly game animals. Also, other essential fats, conjugated linoleic acids, are both part of meat from rumen, from animals like deer and cattle. Vitamin D, probably, and other fat-soluble antioxidants were incorporated in the animals, the game animals, and we got some of our sources of those critical fat-soluble antioxidants and vitamins, including the menaquinone, the vitamin K2, from meat. And now, because we eat much less meat, we are relatively depleted of our fat-soluble antioxidants and our fat-soluble vitamins. When we added starch, sugar, and sodium and inorganic phosphates to our diet, we created great problems, and now, unfortunately, this is commonplace. There was a time when we had a much greater heterogeneous or diverse assortment of plants we ate. This would explain partially why integrative medicine works, that comes from so many different possible sources. The fungi, mushrooms, soy, many plants can contribute. Colorful plants we paid most attention to. They're high in the carotenoids, the beta carotenoids that turn to vitamin A, which is critical. So the Paleo Legacy suggests we should potentially, if we're not balanced, with supplement vitamin D, DHA, EPA, the omega-3s, L-carnitine, carnosine, creatine, choline, menaquinone, vitamin K2. Nutrients that repair DNA include nicotinamide, one of the B vitamins, calcium, folate, another B vitamins, and the carotenoids. We can concentrate on those. Antioxidants can be very beneficial. Once you get enough in your system, then they balance very nicely. And we'll look at angiogenesis inhibitors, those specific molecules which will slow the progression of new cancers and metastasis. And they already include EPA and DHA and vitamin K2 amongst we've talked about. Some angiogenesis inhibitors. There's a large number of molecules that can be angiogenesis inhibitors, and we can discuss some specific foods, or we can think of the molecules and in this day and age go to Wikipedia and see what foods they're in. Menaquinone and vitamin K2 is beneficial not just as an angiogenesis inhibitor, it's probably critical in many other things. Bone strength, perhaps part of the clotting system in certain parts of our tissue. EPA and DHA are the omega-3s. The omega-3s need to be in balance with the omega-6s. I discussed this elsewhere. Green tea, catechins or catechetins are very established as being beneficial as angiogenesis inhibitors. Epigallocatechin 3 gallate is the famous one, ECGC, and you can get these in capsule forms at higher concentrations. It appears more than 3 cups a day of green tea is beneficial, so the concentrated capsules may be worth your while. Curcumin is one of my favorite. I use it as turmeric, but also again, having it in concentrated form is cost effective. Genistein is in soy products. It is beneficial. It needs to be looked at particular circumstances, but the daidzein is contrarily not beneficial. The ratio is about 2 to 1 of the genistein versus the daidzein in soy products. So therefore, it's probably better to take the genistein as a supplement rather than increase soy consumption in general. Indo-3-carbinol and other molecules are in brasilicas, the Brussels sprouts, broccoli, cauliflower. They're very excellent. They should be not, these plants should not be overcooked when eating because that will cause the molecules to evaporate or break down. And with these other molecule names like isothiocyanates, you could go to Wikipedia and look and see what kinds of plants you will get these in. Particularly the sulforaphane are particularly beneficial. My favorites, the flavonoids, because they include chocolate, and dark chocolate is something I enjoy. Quercetin, another molecule that has a long history established to being beneficial as an angiogenesis inhibitor. And the beta-cryptoxanthin and other carotenoids are also very beneficial, and they're colorful. There are many more. There are ones found particularly in mushrooms. I have another video on that. We have other strategies knowing our biochemistry and our genetics. Particularly DNA repair is very critical, and there are things that benefit DNA repair, including the menaquinone, the K2, nicotinamide, folate, and calcium, and there are vitamins that are detrimental. Biotin, riboflavin, vitamin A, if in excess, can cause damage. In deficiency, they cause damage. They have upper limits. There are implications in eating game meat that we get substantial fatty acids, so we need to understand that the EPA DHA, for instance, in game meat, may be beneficial in apoptosis, in killing cells that are normal process of getting rid of cells that are damaged. Without them, we may not do enough of that. So this is a balance provided by nature. So the implication here is that a paleo tune-up is needed for everybody, and that we can benefit from any additional genetics we know, but we will focus on the angiogenesis inhibitors particularly. We do all have genetic variability, but the vast majority of many problems are due to general dietary problems. Diet needs to be put in context of our genetics. Our genetic needs to be put in context of our diet. This means that many studies that claim that something is good for you as a dietary factor must be seen as relative to people that eat a lot of starch, a lot of refined oils, and sodium. And had they been eating more in a paleo way, the supplements may not have been particularly beneficial. So it is a marriage between understanding the biochemistry, understanding the roles of these molecules in the biochemical pathways, and seeing the ecosystem of how it may have evolved our food supply, that we understand better our genetics. Our genetics provides variance so that different DNA can provide different proteins to metabolize things differently. This evolution of processes is, some of it's very rapid, most of it's very slow. Things that are rapid are things that are tuned to some types of dietary change. So in general, the Paleo Legacy has its foundation in what I've said, but it really demands looking at the evolution of protein systems to appreciate how well-founded this is as a concept. In general, I recommend everybody has green tea or a similar molecule. Catechins are valuable. Polyphenol E is an example of a derived medical product. It is an extract of green tea used in HPV or human papillomavirus in genital warts. It is very expensive for a tube of 15%. One can conceive of achieving the same ends by drinking enough green tea or green tea supplements. Menaquinone, as I said, is a vitamin K2. It is very important if people are on blood thinners that they have a good detailed discussion with a knowledgeable health practitioner whether they should be on this and how to accommodate that. As I said, there's another video on mushrooms. And when we think about food choices, it makes sense to incorporate some angiogenesis inhibitors on a daily level. Some of these are fat soluble. They don't have to be done daily. Things that are water soluble tend to have a much shorter time in our system and probably should be done daily. In conclusion, we can incorporate dietary angiogenesis inhibitors on a regular basis. And we can look at the technology in the future to understand how to tune this not so far out. We'll be able to look at our RNA profiles. It's not possible to do that yet. By looking at the Paleo Legacy model and how it supports certain types of foods that also are supported by the Integrative Medicine model, I can make good, strong recommendations, including DHA and EPA, minoxidil, vitamin K2, tocopherols, which are vitamin E, but not the DL or synthetic form, and other molecules, and we can go into that. So I hope you see here that the Paleo Legacy is a model that creates a foundation of a good nutritional plan, and that by tuning things through the integrative medicine model of nutrition, we can create a strategic plan for minimizing the strength that tumors will have.